Hi, my name is Amelia and I'm a radiation therapist at the Bendigo Radiotherapy Centre, operated by Peter Mac. Superficial radiation therapy is often used in the treatment of small skin cancers. In this video, I'll be providing you with some general information about what superficial radiation therapy is and what to expect at your appointments with us. If you'll come with me, I'll take you on a brief tour around the department. Throughout your radiotherapy journey, you may meet many different types of healthcare professionals who will work together as a team to deliver your care. These include your radiation oncologists, radiation therapists, radiation therapy nurses, medical physicists, allied health, and clerical staff. Prior to beginning your radiation therapy treatment, you will have a consultation with your radiation oncologist. Your radiation oncologist will review your full medical history and examine the area of interest. Prior to proceeding with treatment, a small piece of tissue needs to be removed, known as a biopsy, to prove that this is indeed a cancer. Your case may also be discussed with other specialists as required. Your treatment options will be explained to you at your appointment, and we encourage you to take this opportunity to ask questions and to clarify any aspects of the treatment that may be unclear to you. Superficial radiation therapy is one option in the treatment of skin cancer. It is best used for treating small, thin skin cancers or cancers located on areas that may result in cosmetic issues if surgery is performed, for example around the face. Larger, thicker skin cancers can also be effectively treated with radiotherapy, but require a different radiotherapy machine to do so. Depending on the circumstances, radiotherapy is sometimes also used after surgery to reduce the risk of a skin cancer returning. Radiation therapy itself is the use of X-ray radiation to kill cancer cells by damaging their DNA. As a result, the cancer cells are unable to divide and grow, and so the cancer cells die. Radiation can also damage healthy cells. However, healthy cells are able to repair themselves more than cancer cells. The X-rays used when treating with superficial radiation therapy do not penetrate very far into the body, with the majority of the dose being absorbed within a few millimeters. This means that there are limited side effects to the tissues underneath and in the surrounding areas. One of the benefits of radiation therapy is that it only affects the parts of your body being directly treated by the radiation, unlike chemotherapy, which has effects on the entire body. This machine will deliver your treatment using electricity to create low-energy X-ray radiation to target the area your radiation oncologist wishes to treat. Usually, we tape a piece of lead to your skin. The hole is the size of the area to be treated, and the lead protects the healthy skin. The machine will be positioned by your radiation therapist to touch the lead shield. The treatment is painless, and you will not see or feel anything when the radiation is turned on, but you may hear a noise coming from the machine. Before your first treatment appointment, you will be scheduled to have a planning session. Your radiation oncologist will outline the area that needs to be treated. They will also discuss the best way to deliver your treatment with the radiation therapists. The radiation therapists will take measurements and notes so that your treatment will be reproducible every day. They may also need to create personalized lead shielding depending on the area to be treated. Now that you've had your planning session, the radiation therapists will plan your treatment. This plan will be checked by another radiation therapist and approved by your radiation oncologist. On your first day of treatment, a radiation therapist will explain the treatment process to you and your family. Measurements taken at your planning session will be double-checked and confirmed to ensure everything has been prepared accurately from the planning phase. There will always be 2 radiation therapists performing your treatment. In most cases, after the first day, you can expect your treatment appointment to take between 10 to 15 minutes. The radiation itself will typically only be on for less than a minute. The rest of your appointment time will be spent in the room with the radiation therapists, setting you up appropriately and ensuring we are treating the area accurately every day. In most cases, thin lead shields placed on top of the skin will be used to shield the healthy tissue surrounding the treatment area. You can see here that this shield is being used to treat a circular area on the forehead. Everything outside of the circle will not receive any radiation. Sometimes additional shielding can be used for extra protection to ensure delicate structures such as the eye and the inner nose are protected. Once your radiation therapists are happy with your position and treatment setup, they will leave the room to deliver the treatment from the control room. They have a camera and microphone available so they can see you and hear you at all times. The radiation therapists can also talk to you if needed. If you need anything whilst the treatment is underway, please stay still and call out. Even though the radiation therapists are outside the treatment room, they are still in control of the machine during your treatment. The machine will not move once it has been placed in the appropriate position. During your course of radiotherapy and after completion of treatment, you may experience some temporary side effects. To minimize side effects, care must begin on the first day and continue for 2 to 3 weeks after completion of treatment. The side effects you will experience will depend on which area of your body is being treated, but your skin may become red, a bit like a sunburn, in the area that is being treated. These side effects will resolve a few weeks after treatment stops. On your first and last day of treatment, you will have an appointment with our nursing team to go through the best way to look after yourself during and after treatment. These instructions will vary depending on which area of your body we are treating. The nurses and radiation oncologists may also see you periodically throughout your treatment to see how you're going and to help manage any side effects. These appointments also give you and your family an opportunity to ask any questions that you may have. If you have any concerns between appointments, it is very important that you let a nurse or your radiation therapist know. They will be able to direct you to the appropriate person to assist you. Before the conclusion of your treatment, your radiation oncologist will discuss whether you require any follow-up appointments. You may have follow-up appointments with some or all of the following: your radiation oncologist, surgeon, or GP. On the last day of treatment, the nursing team will also discuss options for continuing support for you after your treatment has finished.
Very little. I've had a bit of soreness in the last week because this was the last week of treatment. Small bit of swelling around the treated area, but apart from that, no serious side effects. I'm looking forward to seeing the wound heal up and see the new skin grow over, and to see that the BCCs have finally been defeated. Certainly I'd say it can be a bit scary, but the people here are very good at what they do. They're very professional and they're also very helpful and friendly.
Thank you for taking the time to watch this video. If you have any questions, please don't hesitate to ask your radiation oncologist, radiation therapist, or a nurse.